I'm going to talk about the fixed permanent bridge. The fixed permanent bridge is sometimes called all-on-4 or teeth in a day. The all-on-4 is a trademark of the company Noble Biocare, and they're a dental implant manufacturer, and they're the only company that have done 10-year research on this all-on-4 concept. So what we're talking about is a full set of new teeth in less than 3 days. So who would benefit from this treatment? Well, firstly, there's the denture wearers. Perhaps these are people that have not had the opportunity as a child to actually visit a dentist, or every time they went to see the dentist, the only option they were given is to have a tooth removed. They may have been told they had very weak or chalky teeth, or perhaps they suffered from a lot of gum problems at a young age, and therefore over time have lost all of their teeth. And dentures have been very good. They replace all of the teeth, so they get their smile back, they're able to chew, and they get very few problems from their teeth anymore. But over time, things start to change. When you remove all of the teeth, the first thing that we see is we see the gum and the bones start to shrink. We see that lip support actually starts to change. And we notice that over time, the denture tends to get bigger to compensate for all of that bone and gum loss. So as the denture gets bigger, what we find is the denture gets heavier and it tends to actually move and drop more rapidly. What we're actually seeing here is a lady that has dentures in, but if she takes her denture out, you can see the change in her face. And what we see is we see a loss of vertical height between her nose and her chin, making her chin more prominent. And we also notice a lack of lip support that we can see. If we look at a patient that has their denture in, so you can see here, there's a denture in the patient's mouth. Once the patient removes the denture, you can see how the profile actually changes and we lose all of that lip support. If you look at two dentures, and this is dentures 10 years apart, you can see that his first denture basically was quite thin because he had a lot of gum and bone initially. 10 years later, after all the teeth were removed, you can see how the denture actually gets thicker. And the thickness of the denture is really to compensate for that bone and gum loss. So when we have a thick denture, the main problem, of course, is that this denture is going to start to drop and it's going to start to move around. The second group of patients that would really benefit from this treatment would be those with what we call hopeless or terminal teeth. And they really form into two categories. We've got some clients that come and visit us that really have tried to take care of their teeth. They've been to the dentist regularly, but every time they go, they're told that they need a filling or a root canal or a crown. They're missing some teeth, or they've got pain, or they've got loose teeth, and they're really wondering, should I keep pouring more money into these teeth, or should I look at a better long-term option? We also have the other side that rarely go and see the dentist, and they actually know that their teeth are bad. They may be in pain, they may have loose teeth, they rarely smile, and they really avoid having photos taken. And they may have been to a dentist and the dentist has said, well, you're going to lose all your teeth one day. And really, they're trying to avoid the prospect of having to go to dentures because they have probably heard of their parents or their grandparents having all their problems with dentures, and that's what they're trying to avoid. So what would it be like if this treatment would allow you to smile and laugh freely? You'd be able to eat any food. You wouldn't get the problems or pain from having teeth anymore. What happens if we could do this treatment in 2 to 3 days? You'd be asleep for the treatment, and you'd also be able to design your teeth and smile before we start any treatment, so you know exactly what the outcomes are going to be like. And I suppose, what would it be like to be able to kiss someone you love, knowing that you would have confidence with your breath and that your teeth wouldn't fall out? So what we're talking about here is a full set of teeth in 2 to 3 days. You'd be asleep for the treatment, so you wouldn't know of any surgery or anything being done. This is a non-removable or a secure option, so therefore it's fixed in the mouth and it acts very similar to your natural teeth. We individually design the cosmetics, and the design is actually done for you and by you. You have a lot of input to how the teeth are actually going to turn out. They look and feel like your natural teeth. We know that there is minimal and no bone shrinkage after this treatment is done, because implants tend to allow the bone to actually form around them, so therefore we don't get any bone or gum shrinkage. And we know from the research that has been done over the last 10 years that we have excellent longevity from this treatment. So this is an all-on-4 on the upper. You can see we've got 4 implants here. The number of implants varies depending on the quality of bone. We sometimes do 5 or 6 implants. but you can see the implants are actually placed into the bone and the bridge is placed over the top. On the lower, it's exactly the same, 4 implants, and you can see the bridge, of course, is screwed in. What it looks like in the mouth is this. This is, of course, fixed, and they look beautiful, and they function like real teeth. So what we're talking about here is a greater chewing capacity. Because it's fixed, because it's in the mouth and it doesn't move around, patients are able to eat any foods that they want. We find that there's a greater ability to talk and taste. With dentures, they tend to cover most of the mouth. It means that they cover the palate, which of course is where taste is actually from. It also restricts the tongue space, so therefore speech is actually altered with people that wear dentures. We also find there's greater comfort because it's fixed. It's not like a denture that moves around that can cause things like ulcers or reddening or can rub on the gums. So we know that there's greater comfort. We also know that there's less bone resorption because we're basically anchoring to the bone, so therefore the bone actually is formed around the actual implants and doesn't get resorbed or taken away. We also know that there's an improved self-image and self-confidence when we do this treatment, and of course a greater peace of mind. The reason for the asterisk actually on the notes is that this has all been researched before. This has been questions or questionnaires that have been done with patients that have had this sort of treatment done before. What we're really talking about is a greater quality of life. So why choose advanced dental artistry? Well, I've been a dentist for over 20 years. My father actually started a clinic here in Morley in 1974. I've always had a special interest and postgraduate training in both cosmetics and bite management, and I placed my first dental implant in Switzerland in 2001. Some of the important facts to consider is that we only use specialist anaesthetists when we're doing our IV sedation or GAs. This is very important because an anaesthetist is someone that's been trained in sedation or GAs. I suppose it would be similar to getting a knee reconstruction done and the orthopedic surgeon actually working on your knee, plus also checking that you're correctly sedated. It's very difficult to be concentrating on 2 things at the same time. We also use lab technicians that are present in all your visits. You know that the dental lab is the person that's actually making the all-on-4 or the bridge for you. And it's important that they have the input from the very beginning, and it's also important that the patients are able to talk to them about their smile, the colour of their teeth, before we commence any treatment. We also, of course, use a local lab. We only use Noble Biocare implants, and this is important because Noble Biocare is the only company that has 10-year research on all-on-4 treatment. There are many implant treatments or implant brands around, but the most important thing is to look at long-term research, and Noble Biocare is definitely the implants that should be used for all-on-4 treatment. We also use virtual computer placement with Noble Biocare Clinician, and this is important because it allows us to plan a case virtually before we actually get into the patient's mouth. We do treatment in 2 to 3 days. The reason for the 2 to 3 days is we do see patients from interstate and in the country and from overseas, and if need be, we can actually complete the treatment in 2 days. We'd normally like to give the technician a bit more time, but if need be, we can complete the treatment for you in two days. Everything is completed here in the practice. The only thing we send patients off for is a 3D scan, but everything from the surgery to the bridge placement and all the visits are actually done here in the centre so that you don't need to go anywhere else. We have the same team completing the implants and the bridge, and this is important because the success of the bridge and the longevity of the bridge really depends on where the implants are placed. So if the same person is actually doing the surgery and also doing the bridge at the same time, there is a more streamlined process that goes on. It's important too that we offer a complimentary consultation. There are some clients that can't get this treatment done, and we don't want patients to have a large out-of-pocket expense to try and find out whether they can have this treatment. So we offer a complimentary consultation to make sure that this treatment is actually possible for you before you commit to any major expense. A couple of other things is we're also a member of the Australasian Osteointegration Society and also the Australian Society of Dental Implants. And this is important because it is these organisations that organise most of the postgraduate training in this area. We are also a fellowship and master of the International Congress of Oral Implantologists. This is very important because there's actually 290 fellowships in Australia of the ICOI, but there's actually only 4 masters, and I'm actually one of them in Perth. The other really important factor is that we've got an amazing team here at the clinic. We really have very much a team approach, and that gives you the best overall outcome. So let's look at a case now. I'm going to just go through a case here with you. This is Les. Les has actually come to see us because he is actually suffering from extremely bad gum problems. With his teeth, he's had a lot of dentistry done in the past. He's had bridges done on one side and crowns on the other side. But you can see that his teeth are starting to fail. He's getting a lot of gum recession. And at the moment, he's getting a lot of pain from his upper teeth. So what we actually do is we use computer imaging to plan his case. And what we're able to do with computer imaging is we can load all of his information onto our computer system, and using a clinician here, we're able to actually look at his bone, zoom up on his bone, we're able to see into his sinuses, we're actually able to place his implants virtually before we do any surgery, so we know that we can deliver his treatment. Each case is individually designed, not only from the teeth, but also from which implants go in which area of the mouth. What we're doing here is this is actually part of the lab technician. The lab technician's here, and what he's doing is he's actually looking at the shape of the teeth. He's having a conversation with the patient, deciding on the shape and the colour of his teeth. And what we're doing here is we're planning everything to make sure that there's no guesswork when we come to actually doing his treatment. Treatment day involves removing all of the upper teeth, removing all the infection and the problems in his mouth, and placing 4 to 5 implants. In this case, we've actually placed 5 because the bone was very, very soft. The next day, what we actually get back is we get back this bridge, and you can see there's 5 screw holes. These screw holes get filled up with white filling material, so you don't get to feel or see them. And what we do is then we place that into the patient's mouth. So this is Les before, and this is his teeth after. You can see much better shape and also much better biting actually with his teeth. And this is a after image of Les. I'll just show you a before and after photos. This is Les before, that's Les after. So if you have any questions, please give us a ring on 1-800-SMILING, or you can always email me at adriankat@mac.com. I look forward to seeing you in the practice soon.